Hi, everybody. My name is Rick Mars. This is me. I'm from Miami, Florida. I have done over 1,700 Invisalign starts, only have about 9 finishes, but really good at starting. So that's why I'm here tonight. That is joke number 1 of the night. I can't hear you laughing, but that's the webinar world. I'm on Align's global faculty. I'm Align's GP faculty member of the year previously. I'm a Propel Key educator. I went to Emory University and Georgetown University School of Dentistry. And I introduced this amazing book called The Big Smile right at the beginning of the pandemic. Great time to release a book. Basically, I've been practicing for 3 decades now, and you learn a lot in 3 decades. I wish I knew the things on day 1 that I put into this book, the things we worry about, the things patients measure us by, how to make your patients happy. And it's also good for patients. It gives them a good idea how to be good patients. And we all know they're not all good patients. So we're not here to sell books tonight, but you can get that anywhere, Barnes & Noble, Amazon, Target's websites. But I'm very proud of it. It's not a very expensive book. So for 15 bucks or so, you will be filled with pearls, and pearls is what education is all about. This is one of my offices. This is our day of giving. It's called Dentistry from Our Hearts. And we give away about $150,000 worth of dentistry. We're approaching our 10th year, which we had to postpone this year because of the pandemic. But we will make that happen because I really want to hit that $1.5 million giving away a free dentistry, because I bought the balloons already. So we got to do the event. So there it is. So you're here tonight for one reason. You want help doing your cases. And the aligners don't always do what you expect them to do. And what tools are available to you to make your cases more predictable, to get your cases done in less time? Well, those tools are available, and that's what we're going to talk about. So this is the world we live in today. And hopefully this is coming to an end. I'd like to say this looks like my reception area, but my reception area, like many of your guys' reception area, is currently closed, unfortunately, but it will be opening soon one day, God willing by summer. But hopefully this will be a thing of the past that we talk about as way back when, in the days of the pandemic. Hopefully we do not get to see this in the future again. So, you know, different people are in different places. I happen to be very fortunate in my practice, but we do have reduced capacity. We've shortened our hours. We're seeing less patients because we don't want to have as many people around still. Everybody knows our expenses have gone up. PPE, some of your dental supplies, they've creeped up. Everybody needs to make up for lost revenue. Labs are charging more, different things are happening. And you guys all know this, when your first name is doctor, things automatically cost more money. Things are taking longer, all right? Donning your PPE, setting up your screens, your shields, everything else. I had somebody say to me, I was on the tennis courts this morning, and one of the guys I play with was in my office yesterday. He goes, God, I noticed you were like moving in and out there, and never noticed that before. And he was making a reference to my eyes, because he said I thought I made a bad call, which I didn't. But he thought I made a bad call. And so he goes, you were moving in and out. I'm like, well, Danny, I'm actually looking through not just my glasses and my loupes. I'm looking through a shield over my face and then a protective shield over the patient. So lots of times there's glare. So that's why we're moving in and out on you. So things take longer. And because of that, sometimes we have to see the people more often. Are your starts up or down in your office? Are your profits up or down in your office? Hopefully you are up. It has been a good time for Invisalign. They're coming off their best quarter ever. And hopefully you're seeing that in your office. But if you're not, you need to ask yourself why. So what are our differentiators in our practice? Is your practice efficient? Do you give the patients an amazing experience? I'm not selling books. That's what I focus on in my book, is that patient experience. The patients don't know when you did a great DO on tooth number 13, but they know how long you made them wait. They know how you treated them. They know if you hurt them. They know about the bells and whistles in your office, but they don't know about that DO on tooth number 13. When's the last time you had a patient come in and say, I heard you did a great root canal on my wife on her number 19 tooth. Could you do the same one on me? It doesn't happen. So people are looking for us to become quicker, more comfortable, and they don't want to come to our offices. The vaccine, no vaccine, people are still scared. Let's face it. Your staff's still scared. Many of you are still scared. I have my concerns still. I've been vaccinated for a couple of months, but I have 95% coverage, but I still wear my mask every opportunity. I still dine outside still. So these things are going on, and I know I'm not alone. But let's look at some numbers. And I think these are going to blow you away. So all of you think that you get done with your Invisalign in one set of aligners. And we know that's not common. All right. Most of you take multiple sets of aligners to get things done. 20 months treatment, 18 appointments. Those are the averages. There's a reason here tonight. This webinar is sponsored by two amazing companies, Align, the makers of Invisalign, and Propel, because the two of them got together and said, you know something, there's a message to be heard tonight where we can change this narrative here right now. We can change these numbers here tonight, and that's our goal in this hour. So if we can reduce the duration of our appointments, who wins? Everybody. If we can reduce the number of visits, who wins? Everybody. So you know that little joke I made at the beginning? 1,700 plus Invisalign starts and 9 finishes? That's a joke, but it's not, because at the end of the game, it's not how many cases you start, it's how many cases are you finishing and how quick are you finishing. Our cases, I was on a call today with somebody from Invisalign, and I was telling them about this webinar tonight, and the person said to me, he goes, oh my God, he goes, I was a 3-year case. I wish I would have had Propel. And so a lot of people wish they would have had Propel, and you will see why shortly. So we play the same game as specialists, same game as orthodontics. We use the same ClinCheck. We have the same Invisalign aligners. They don't have better aligners. We have the same Propel that they do. But what are they doing different than we are? And the answer is efficiencies. They do Invisalign all day, day in, day out. Many orthodontic practices have become Invisalign exclusive, and that exclusivity has allowed them to have efficiencies in their office. I'm doing a lot of Invisalign in my office. Some of you are doing just as much as I am. Some of you are doing less. Either way, you have to be efficient. You have to get those patients in and out. And you have to finish your cases in the shortest period of time possible. And you have to know what are some of the good things out there and what are some of the bad things out there. This is not a good thing. All right. This is what I call the first aligner assisted device. What is it? Exactly what it looks like, a tire. And I swear to you, this is real. I swear to you, I had a patient cut up a piece of tire because why? He couldn't find his Propel. So this is something that the patients used, and it didn't work bad. Actually, he finished in, maybe he had an additional set of refinement of maybe a half a dozen aligners, but trust me, the Propel is what made it happen, not the tire. So we do not advise you to have your patients use this, but this is real. I cannot make this up. And I did not ask if it was a new tire or not. I didn't want to know. So there's a lot of competition out there, okay? We're dealing with direct to consumer, your Smile Direct clubs, and we're evaluating our fee structures. Invisalign's come up with some amazing products. We're treating patients virtually now. But if you're not embracing some of the things available to you now, like third-party financing, you're not closing cases. You're not playing 2021 dentistry because you need to be efficient, offer all the bells and whistles to your patients. And we need to educate our patients better, because when we educate our patients better, you have your patients that are inspired, you have your patients that are closing more and more cases. So clear aligners have evolved. Aligners are doing better things now. I started Invisalign in 2003, and Invisalign had a reputation as just tilting teeth. That's what it did in 2003. It tilted. What does it do now? You can translate a tooth, you can extrude a tooth, you can intrude a tooth, you can rotate teeth. We have tremendous materials. That Smart Force material is tremendous, and it does amazing things for our patients. But accelerated orthodontics has also become the name of the game. We need to get the cases done efficiently, and we need to use the auxiliaries that we need so we can get better treatment in fewer visits. So Invisalign has been around for 20 years. You can virtually do any case now with Invisalign, and look at this number. Over 9 million cases worldwide. 9 million cases it's surpassed worldwide. And it just keeps ticking and ticking and ticking, and soon I'm sure they'll be finding who's the 10 millionth case that's been done with Invisalign. But the good news is Propel, has been around for 10 years also. And you have a couple of different options. You have an in-office option, an at-home option, and Propel is currently approaching 1 million patients worldwide. So these are two companies that have a proven track record. We know they work. They have this, people aren't trusting the science now, when it comes to vaccines and things like that, but the science is here for both of these products. And if you're using one, you should be using the other if you really want to maximize the efficiency of your clear aligners, your Invisalign. So let's look at profitability, because I do whole lectures on profitability, on workflow. The last 2 nights I've been doing some lectures in different regions on workflow, but I always talk about profitability because most of us don't get profitability. So let's take a look. If you have this patient walk in your office, 23-year-old female, you get the ClinCheck back. It's 84 aligners. It's going to take 33 months. Now, look at the laterals. Look at the canines. Look at the deep bite in this case. This case takes a tremendous amount of expansion. 84 aligners, 33 months, just under 3 years. Can I do this case? Absolutely. Would I treat this case? No way. Why? Because if I'm treating this case as is, 84 aligners, it's extremely unprofitable. I cannot charge enough money. This is the one that I'm going to send out to the orthodontist and say, good luck with this one. Okay, 84 aligners, see what you can do. Now, if we accelerated the case, is that a different story? Absolutely. But if you get a ClinCheck back and you're not doing auxiliary techniques like Propel or accelerated dentistry, orthodontics rather, with Propel, don't even think about doing this case. Here's a rule of thumb for you. I generally refer out cases that are 35 to 40 or more aligners. They don't make sense for us to do. When you break down what it costs per visit, and here's a little number for you that you need to chew on here tonight. They used to say that it costs between $15 and $20 to turn a room over per patient with disposables, sterilization, assistant time, so on and so forth. $15 to $20. Then we had this thing called COVID. That set in. The cost now, with everything we're doing in our room, with the chair covers and the new equipment that we must use to sterilize rooms and things of that nature, somewhere between $30 and $40 per patient to turn a room over. And that doesn't include burrs, IPR devices, anything like that. That's just your turnover on a room. So when you get cases that are more than 40 aligners, you should be referring those cases out. You want to start more cases. And how do you start more cases? It starts with education. It starts with educating your team. It starts with educating, then it goes to educating your patients. If you're going to do one and not the other, you're going to lose. And if you're using a scanner, and I hope you are, that means you're playing big boy or big girl dentistry, you're going to close more cases. And you need to scan every patient possible. I know here it says scan every patient. We know that's not always possible, but scan every patient possible. The next thing you need to do is increase your patient compliance. You want to get done in one set of aligners whenever possible. So what's your secret here? vPro. Use vPro. You're going to reduce the patient comfort. You're going to ensure the aligner seats, and you're going to have more compliance from your patients, because even if they're not giving you the full 22 hours a day, using vPro will help you close the gap from their non-compliance. And that's what you're doing. You're going to recover from their non-compliance versus doing more refinements. The biggest joke in the world that I laugh at is when doctors say, don't worry, I do refinements on every case. It doesn't cost me anything. Really? Let me ask you a question, doc. Are you taking impressions or scanning? Well, I don't have a scanner yet, so, oh good, impressions. You know those cost you $25 an arch? $25 an arch? Yeah, and your assistant, she usually takes like 3 sets of impressions, so you're probably dropping $150 on impression material alone. Oh, you're taking off the attachments because it's a whole new case when you send it in for a refinement. So now you got to go put the composite back on. You know what those little tubes of composite cost? Go find out tomorrow. So it all adds up. There's no free lunch. You have 5 years when you do Invisalign Comprehensive of unlimited aligners, but there's a lot of cost involved. Plus, every time you put the butt in the chair, that's another $40 on the tab also. So these adjuncts, are they worth it? Well, I think so. Look at the numbers here. If you do a procedure and you're making $400 on the procedure, netting, as in something you would do if you were doing a 10-visit aligner case, $400, 10 visits, $40 each visit, you're losing money doing that case if you're not doing it efficiently. So it's really, really important that you get the cases done in as few visits as possible, as few sets of aligners as possible, and therefore you're going to stay extremely profitable. So let's look at some more numbers. So this is national averages. $5,800 case fee for Invisalign, including retainers. And depending on where you're practicing, I know we're all in Florida, South Florida here today, but depending on where you're practicing, it might be a little higher, a little lower, but that's kind of an average right there, $5,800. The aligner fee, $1,829. We ran that down to $1,800, and we took our Vivera retainers from $275. We raised that up. So your net fee there for your lab, $2,100, is right on point. That gives you a gross profit of $3,700. That's a wonderful, wonderful number. That is the most profitable procedure you can do in your office, as long as you get it done in a reasonable amount of visits in one set of aligners. If you have to get into multiple sets of aligners, look what happens to your profit as the visits go up per visit. It really becomes very, very unprofitable. And the name of the game why we go to work is profit at the end of the day. Now, we don't even look, okay? When we go and we add V-Pro into the case, Propel V-Pro, it adds $449 to your lab bill. That's if you're buying one V-Pro. If you buy more, you can lower the cost of your V-Pros down the road. But we don't even look at the cost of what a 15-visit case is, because that's out the door right now. We're not going to have cases that last that long when we're using vibration or Propel in our cases. So it's very important for you to know what happens to your profit when you shrink those visits down. Your profits go up. If you include retainers and V-Pro into the case, the numbers obviously change. So you can charge for it if you choose to. You can include it if you want to. If you notice that previous slide, if I go back, you were including the retainers. We don't want you to include the retainers. We want you to charge for the retainers. We encourage you to charge for the Propel if you choose to. But either way, at the end of the day, you're making more money because you're doing the case in less visits, and the case is now more predictable. So again, let's look at some profitability numbers here. You saw this number before. You see the aligner fee. You see the fee for the Vivera. That number is $2,100. Net profit, $3,700. That takes 2 to 3 hours is what the case should take you if you're doing it smart, if you're doing it right. And that's where your profit numbers look really, really sexy at the end of the day. We will all take $1,200 to $1,800 plus profitability per hour. Yes, you're paying for your assistant. Yes, you're paying for your electricity. Yes, you're paying for your rent. That you're paying for anyway. But as far as the procedure goes, there is nothing more profitable than Invisalign if you do it efficiently. You just have to do it efficiently. If you're not doing it efficiently, you're not maximizing your profits. So if this sounds a little salesy to you, I apologize, but at the end of the day, most of you aren't understanding this. Most of you are losing the whole idea of why you're going to work at the end of the day. You're getting caught up in, oh, I'm doing all these Invisalign cases, but how many cases are you finishing? How many refinements are you doing per case? That's what we're trying to cut down. So time is money, okay? So you just saw that amazing number. Go back again, $1,200 to $1,800 per hour. All right, one set of aligners. Now we have a refinement involved. Everything stays the same at the beginning, right down to that, except the case doesn't take 2 to 3 hours. It now takes 4 to 5 hours. What happens to your $1,200 to $1,800 plus per profit? It's cut in half. It's cut in half. So that's the difference between one set of retainers and 2 sets of retainers. Your time is worth money. You could be doing more profitable procedures than refinements if you get those cases done in one visit. How do you get the cases down in one visit? Here's your answer right here. The V-Pro 5 minutes per day, high frequency vibration. It's the 5-minute acceleration device, V-Pro. You have an in-office solution available to you. Okay, this is for micro-osteoperforations. This is also called Propel. This is what with the original Propel that we knew prior to the high frequency vibration. Takes about 15 minutes in the office. You can use a driver, electric driver that it comes with, where you just swap out the tips, or you can also swap out the tips with this accelerator RT, where you do the hand rotary in your office. But we're going to focus a lot on high frequency vibration right now. And basically, it's our first line, okay? It's what you want to use with your Invisalign, put it together with your V-Pro, and what's going to happen? You're going to decrease your office visits. You're going to increase your predictability. Patient comfort is going to be reduced. Patient discomfort is going to be reduced. It's a superseder of the aligner. I have used Chewies. I have used Munchies. They're great. This is exponentially better. Why? Because that 5 minutes of vibration does a lot more stimulation on the bone, so it supersedes your aligner. It allows you to recover from lag, that gap in the aligner that allows you to recover from relapse in retention phase for patients who don't wear the retainers, and we're going to cover all of this right now. Our second line is our micro-osteoperforations. And basically this is done chair side. It allows for increased speed of aligner change. I tend to only do aligners 7 days. Occasionally I will cut it to 5 days in certain areas, but there are many doctors that have cut their aligner wear down to 3-day intervals when they need to speed up the case. It reduces the root resorption because basically you have to think of this as softening up the bone. It increases the cytokine activity, which makes tooth movement more predictably because you're temporarily softening up the bone. This takes you about 15 or 20 minutes in the office. When do you use it? I like to use it basically for pinpoint difficult areas where I know I have a blue or a black movement in the case, that I know I'm going to need a little extra help. And I have a patient that I'm worried about compliance about them using the V-Pro in addition to changing the aligners as I need to. They don't need to do anything. Here, everything is done for them. And this is not new science. This has been around for over 100 years, okay? You might have heard of Orthodontics. This is what the original stimulation of the bone went down to, but Propel's been around for over 10 years now. There's a ton of peer-reviewed clinical trials on it, so it is not something new. It is there for you. You can, those of you that love the science, it's all there for you to read anytime you want. That's what it looks like. This is 5 minutes post-op doing micro-osteoperforations. The bleeding stops. You have your patient stay away from aspirin, Advil, Aleve because you don't want to decrease the cytokine activities. You don't want to decrease inflammation here. But this is what it looks like 5 minutes post-op. Now, I know some amazing doctors who figured, you know what? I'm going to cut a corner. I'm going to save a couple bucks. And nobody really wins when you cut a corner or save a couple bucks. Trust me. I've been practicing a long time. I've done pretty well. There's nothing I've ever done to compromise treatment in my career. Less expensive labs, doing crazy things with my patients, cheaper composites, anything like that, that I've ever done that I can look in the mirror and say, I've done this, I've saved money, patient didn't know it was a good thing. I won't do it. We have an ethical responsibility. Our patients trust us and they trust us to give them the best. So you're giving them the best aligner when you're dealing with Invisalign. So you need to give them the best when it comes to doing these procedures. Do not go grab a burr and say, I'm just going to pop a hole in the bone because that's going to do the same thing as a mop. Absolutely not. Number one, look at the red things, the red notations here. The roots are in danger of being nicked. You can get heat necrosis in the bone. You can get a surgical irritation. Basically, you're creating a surgical irritation and you have soft tissue trauma. You're doing a tissue punch when you hit a burr. I mean, there's nothing good here. This is not a mop at all. You're taking away bone, and that's not what you're doing here. You need to create a micro crack. That's what a mop is. This is what people don't understand. When they're going at it with a burr, you're creating a hole. When you're doing a mop, you're creating comprehensive stress and radiating micro cracks, and you're changing the bone chemistry. All right, let's go back. Remember our biology courses, osteoblasts and osteoclasts? Well, it's that simple. When you're doing aligners and braces, you have inflammation going on in the bone. You have cytokine activity going on. Inflammation, generally, we don't like as dentists in the mouth. But when it comes to tooth movement, it's a good thing. That's why you should be telling your patients stay away from anti-inflammatories, aspirin, Advil, Aleve during tooth movement. You want that cytokine activity up, not down. So stay away. Take Tylenol, extra strength Tylenol if you need it. But bone remodeling is going on, and that allows you to have tooth movement. When you use a MOP or V-Pro, one or the other, what are you doing? You're amplifying all that activity. You're increasing cytokine activities, you're increasing the inflammation, the bone is remodeling better, and therefore you get more predictable tooth movement, okay? The osteoclast is moving in that area, osteoclast formation, and you're eating away at the bone like termites over here, but the bone is filling in over here slowly. And it takes longer for the bone to fill in. That's why you have some mobility of the teeth oftentimes when you're done with your Invisalign treatment, because the osteoblast has to catch up to the osteoclast activity. It's that simple. Remember your basic biology. That's what's happening. And when you use the V-Pro or the MOP, you're amplifying it and it's making that bone more, that movement through the bone more predictable. That bone remodeling increases and therefore your movement becomes more predictable. Your osteoclast activity goes up. You have an ortho force put on a tooth as you're moving it. And when you're putting that V-Pro in there along with the aligner, it's increasing the osteoclast cell activity, that cytokine activity. The aligners seat better when you're using it because you have increased circulation in the area because you have increased inflammatory response. So if you have aligner gaps, you can overcome aligner gaps by using the V-Pro. The numbers don't lie, okay? Look where these studies were done. Some of you might have heard of this dental school, Harvard, NYU. These are amazing, some of our top dental schools. They've run these studies. 44% less discomfort when you're using V-Pro. And look at the right. This is what will blow you away. So we're going to talk about days you change aligners, but if you do 7-day aligner change with V-Pro, the aligner tracks 90% of the time. Better than it would if you were doing 14-day aligner changes. So 7-day aligner change with V-Pro, 90% tracking versus the ClinCheck. And we now have this data available to us because we can scan a patient into treatment with your iTero scanner and see how things are tracking or not tracking. So if a patient's compliant, 7-day aligner change with V-Pro, you're gonna have 90% aligner tracking. That is awesome. And the technology is great. You know, one of the things I love about Invisalign, they're always innovating. What we're doing with Invisalign now, like I told you earlier, is off the charts what I was doing when I started in 2003, and Propel does the same thing. We're on the 3rd generation now of V-Pro, okay? We have a Bluetooth compatibility. We have a bigger battery. We have USB-C charging right now. And with teledentistry and everything else, we have an app where patients can go track everything through an app. So the technology's gotten better and better, the efficiency's gotten better and better, and we have all the patents on high frequency vibration. So anything else you see, that's just a knockoff. And we are the makers of it, we own the patents on it, and nobody does it better than Propel does in terms of high frequency vibration and the benefits of it. So I mentioned aligner changes and what happens with aligner change. This is one of your pearls that you should be walking away with. We're all doing 7-day aligner change for the most part. Why? Because several years ago, Invisalign came out and said, this is now our protocol, 7-day aligner change, because most cases are just as predictable with 7-day aligner changes as they are with 14. And the quicker you get the case done, less chance for that patient to be non-compliant. But if you read at the bottom of that study, or that instruction sheet, I should say, it says, at the doctor's discretion, monitor tooth movements such as rotations, extrusions, and significant root movements, particularly blue and black movements. In the tooth movement assessment, depending on the patient response to treatment, particularly mature adults, nice way to say older people, consider longer periods between aligner changes. So it's 7 days for everybody, except for difficult movements and elderly patients with difficult movements. And those of you who don't know this, on your toolbar, when you're looking at your ClinCheck, please make sure you have the tooth movement assessment button activated. If you do not have the tooth movement assessment button activated, you do not know when you're doing a moderately difficult movement and a very difficult movement with the case. Moderately difficult is a blue movement. An advanced movement is a black movement. A blue movement, it is suggested by Align that you use auxiliary techniques such as Propel to bring the case to completion. And if you have any black movements in the case, it's telling you that you should use it. One is suggesting you use it. The other one's telling you should use it if you want to bring your case to successful completion. You should use auxiliary techniques. The alternative is all green movements. That's very predictable, easy movements. So it's very important you know that if you're getting into more difficult movements, you should be using auxiliary techniques. Now, this is an amazing thing that just came out, and this is the latest technology. This is called the G8. I'm sorry, Invisalign introduced G8 attachments and smart force features, aligner activation features. And essentially what this is doing is two things. It's allowing more predictable expansion in the molar area. It's allowing less possibility for posterior open bite by allowing those molars to track properly. And it also works great with deep bite cases. So these are great innovations that just came out from Invisalign about 6 months ago. What's your message here? The message here is Invisalign's doing more and more and more, and it's looking to get into more advanced cases and become more predictable with it. But when you're getting into these more advanced cases, you need to stack the deck in your favor. How do you stack the deck in your favor? Propel. This allows you to do the more difficult movements. It takes 5 minutes a day. We tell patients initially to do it twice a day for the first 2 or 3 aligners when they're first getting started. You could tell them it's 5 minutes. You could do it twice a day through the whole treatment if you want to, morning and evening, whatever it is. You cannot do it too much. And you can see your patients less frequently as long as you're not performing IPR. You know they're tracking. You can even track them virtually because Invisalign has great features. Now they have something called virtual care where the patient sits there with cheek retractors. Somebody takes their photos, they send the photos into you, and you can see these patients very safely, very predictably with 12 to 18 week gaps going between appointments. 12 to 16 week gaps going through appointments because you're able to track them virtually. You know that the movements are predictable because they're using a V-Pro in their case. So you can make decisions, but we have used more and more V-Pros with our cases. We use them on virtually every case. I ordered another 20 that I just got in my office yesterday. And you know what I'm seeing? Very few refinements. I almost get upset at myself when I have to have a refinement, but I know why. We set up cases, we do predictable cases, but the V-Pro is my magic wand that I keep in my back pocket. So what are the benefits? It significantly reduces the visits in the case. It adds value to our treatment and it differentiates us from other practices. How many times do you get patients into your practice on consultations and they've been to 2 or 3 offices, but you're the only one talking about V-Pro? So that puts you on a different level. I'm an instructor for Invisalign. That puts me on a different level, but you need to stack the deck in your favor. If you're not an Invisalign faculty member, what can you do to set you apart from the person they just went to in the other office? And then you can decide, am I going to charge for this or am I going to include it? Because if I include it, I'm going to get done in one visit, and that's going to keep my profitability way, way up at the end of the day. The other benefits, it improves your tracking. Even if the patient's not doing what they're supposed to be doing 22 hours a day. How many of your patients are wearing them 22 hours a day? You'd be shocked how few do. And you need to know this. When they come in, you need to ask them questions. And the first question I always ask is, hey, how many hours a day are you wearing your aligner? And if I don't hear 22 hours a day, if I hear most of the time, except when I'm eating, I keep pressing them. How many hours a day are you wearing your aligner? And until I hear them say the hours, then I know. So you must push them 22 hours a day. But if they're not, guess what? My deck is stacked because I got a V-Pro in the case, and that's going to reduce the opportunity for the patient to have to go into extensive treatment, additional aligners, and that's the name of the game, as I proved to you earlier. So what do? Do you include it with the treatment? Do you charge extra for it? How much do you charge? Well, here's what I do. When I know I have a very difficult case, instead of saying to the patient, hey, I'm going to raise your fee up, I say we need to include a V-Pro into the case. And I'm on the upper end there. I usually charge about $700 for a more difficult case, or when I'm including the V-Pro in the case. And I'm not giving it away. Occasionally, if I think it's a simple case, I'll give it away. I'll say, I want to keep it predictable. I know I'm going to have few aligners. I have no IPR in the case. Let's keep this patient on track. And I got the cost of the VPRO going into it, but I know I have a very easy case with VPRO. So I'm going to be done. I'm going to be done in one set of aligners, and it's a very quick, rapid case. So you decide if you're going to charge extra, you pass it through. If you're not presenting it, then you decide what you want to do with it. But you're going to create value. And that's the important thing at the end of the day. Patients are going to know you're different. Patients are going to know you have a tool available to them that a lot of people aren't using. I mean, face it, most of you are Invisalign providers. Most of you, I assume, if you're on this webinar tonight, haven't used VPRO before, or you have, you've kind of just dabbled in it. But now that you've seen the numbers, you need to know why you need to be using it so much more than you are, because you're going to be able to do more predictable cases, more extensive cases, which I'll show you shortly. So here's a paradox for you, okay? Vibration paradox in orthodontics, anabolic versus catabolic effects. So high frequency is identified to have dual mechanism of action. What does that mean? So when we are in the retention phase and our patients are wearing retainers and we use vibration, instead of decreasing bone density, which we want when we're moving teeth, it actually increases bone density. When we're in active treatment, where we're removing teeth and we use high frequency vibration, the opposite action happens. Inflammation's elevated, cytokine activity is elevated, and bone density goes down. So let me clarify. When you're wearing retainers, when you're not moving teeth, you're just wearing retainers, you're holding them, there's no orthodontic force or pressure put on the patient, and you're using VPRO, it's actually causing the teeth to tighten up. The bone density is increasing. It's making retention more predictable. The opposite happens when we're moving teeth. We have an orthodontic force being placed on the teeth. We're using high frequency vibration with it. Inflammation's elevated, bone density goes down, cytokine activity goes up. That's more predictable tooth movement. So it's amazing this one device plays two roles. It's almost unbelievable, but it's true. And you will see it because at the end of the case, like I mentioned, you often will have patients because the osteoblast doesn't catch up to the osteoclast activity and the teeth are mobile at the end of treatment. Have them wear their retainers, use your VPRO, they have it already, and you will watch those teeth tighten up. So these studies are great, okay? There's studies of vibration in modern medicine. The first couple are related to tooth movement and orthodontics. At the conclusion, if you read the first one, vibration can be utilized to accelerate the rate of orthodontic tooth movement during the catabolic phase of treatment. And in that anabolic phase, what happens is it increases the bone density and decreases the cytokine activity. And it has uses in diabetes and stroke, vibration. There's ways that they've looked at things that it's done with patients' legs and things like that, and helps people with stroke with their muscles and things. So vibration has been around a while, but as you see, we've had studies that have been going on for several years now that back up everything we're saying when it comes to vibration and the anabolic and catabolic effects that it has, depending on what you're doing. So why is it so important in retention? Well, 40 to 90% of orthodontic patients relapse within 10 years post-treatment. We all know this. Why do they relapse? Two reasons. They stop wearing their aligners, that's the obvious relapse, or they are wearing their aligners and they're coming in saying, you know what, I swear I wear them every night. What happened? What happened? What happened? So look at the numbers here. Perio tissues take a year to remodel after treatment on average. The PDL takes 3 to 4 months. The gingival collagen fibers take 4 to 6 months. And the elastic supracrestal fibers take more than 7 months to really go back to where they were before tooth movement. The bone density has been shown to decrease 23% during treatment and can take up to 2 years to get back to where it was prior to tooth movement. So we're doing great things, but we kind of owe it to our patients to restore their bone density, to do everything we possibly can to restore the bone density at the end of treatment. So when we use VPRO, what happens? Okay, it increases bone density 37%. The soft tissue is 125% increase in those PDL fibroblasts. So when we have patients that we've got great finishes on and they had poor retainer compliance, we use our VPROs. The patient has a VPRO from start to finish. You tell them to charge it up again. get those retainers in as best they can, because we don't want to see the gaps, and have that case reseated with a V-Pro, and you will watch yourself capture the case again. So you're helping the patient out, because none of us like to say to our patient, you need to go back into aligners again. There's a fee for it. I hope you don't give it away to your patients for their non-compliance, or else you're really losing money. But there's a simpler, better way to do it. And your patients are going to be happy that you gave them the tool that they needed to recapture their case at the end of the day. So here's our retention recipe. When we have a V-Pro at our disposal, because they use that in their case, we go full time on the aligners for 90 days, sometimes 60 to 90 days, depending on the amount of tooth movement. We use the V-Pro just one time for 5 minutes. All right, then we go to nighttime wear, and if we're still having mobility of the teeth or any concern at all, they can continue with the V-Pro for a couple more months until everything really tightens up good. But that's your recipe model there for when it comes to retention. If you have concerns about remodeling, mobility, retainers fitting properly, this is what you need to do if you have that V-Pro at your disposal, and you should if you've used it in your case. So we all know about the toughest teeth and movements for us GPs with Invisalign. Here they are. Number one, we'll all agree, maxillary laterals. Number two, of course, right, maxillary laterals. And number three, maxillary laterals. We have seen this in all of our cases. It is by far the tooth that is going to track the least. It is the tooth that has more attachment combinations than any other tooth in the mouth from Invisalign. Why? Because we know it's the toughest tooth in the mouth to track. Its surface area, roots, caught between those two wide teeth, our central incisor and our canines. So it's a tough tooth to track, and we want to do everything we can to stack the deck in our favor so teeth like this continue to track. But all kidding aside, these are the tooth movements that are difficult. Maxillary laterals, extruding canines, mandibular incisors, that little surface area, rotations are oftentimes for a lot of us very tough to do. Crowding or spacing cases greater than 6 millimeters, that means you're falling into the blue or black range when it comes to tooth movement. Rotations greater than 40 degrees, and any of those blue or black movements can be difficult, but we have the solution. This is going to make these tough tooth movements more predictable. High frequency vibration or micro-osteoperforations with Propel. So let's look at a couple of cases, and I'll show you some of the things that we can do, okay? So what's our diagnosis? Class 3 molar relationship. We have a midline shift, severe crowding, tooth size discrepancy in our restorations. And we had one set of micro-osteoperforations put in the case. We call them MOPs. And look at the beautiful finish we had there. 7.5 month case. If you're not using vibration, you're not using MOPs, how long do you think it would have taken you to do this case? Not 7.5 months. Okay, class 1, division 2, deep bite, severe crowding case. One set of MOPs, 19 aligners, 5 months. Now you're going to ask the question, when do you use MOPs? When do you use vibration? Well, in this particular case, we know what the most difficult movements are in this case. And I would say you're probably looking at certainly anterior teeth all around, but I would be more concerned with those laterals. I think we're going to do pretty easy on those centrals. And when you look at your tooth movement assessment, or you look at your tooth movement table with Invisalign, it'll show you what the lead or more difficult movements are. And you can decide where you're going to place your MOPs. So we know where we're going to do it. We didn't want to have any compliance issues. We're happy with the patient wearing these aligners alone, but we had a great case, great result, just doing MOPs, 5-month case. Check this case out. This is one of my all-time favorites. I think he's going up on my Instagram because I've never posted him, and it's time that I post him to really show what we can do with Propel and Invisalign combined. Look at the man's face. He did not put on 1 pound. This is a 6-month case. We virtually changed the shape of his, not his arches alone, his entire face with expansion. This was one MOP application. This is 24 aligners. That's what the close-up shots look like. Yes, there was teeth that had bone loss in the case, Nothing was lost. There were no mobility issues afterwards. Look at the movement of that upper right second premolar, number 4. Look at that tooth slide into space, in that space there. Everything expanded beautifully. Patient was 100% compliant in this case. I'm not going to lie to you. Here's what the ClinCheck looked like. A lot of expansion. This is why I go to work every day. This is why I don't get bored doing Invisalign. Beautiful cases like this. Let's take a look at this one. So we have an open bite. We have a posterior crossbite, narrow maxillary arch, 33-year-old female. Long case here. I know I sound like a hypocrite. 47 aligners, 8 visits, 10 months. This case does not get done without vibration. Look at the results. Seeing is believing. Okay, I'm not going to lie. This was my favorite case in 2020. Severe crowding case. She came to me looking like she did on the left. She left looking like she did on the right. I was debating if I say this or not. If I offend anybody on this call, I apologize. But she not only started with the teeth on the left, but she had a 63-year-old boyfriend, and she finished with a 21-year-old boyfriend. That's a fact. Don't be judgmental, okay? But talk about a change of confidence. I'm not going to get into the details, but look at the difference this case made in this patient's mouth. This is what the ClinCheck looks like. There is no way you get this case done in one set of aligners, 30 aligners, without vibration. Amazing. So, question. Can you do this with 30 aligners and no refinements? Can you change a patient's smile from that on the left where she could not even smile because that's how she hid her teeth to that on the right? Can you change patients' lives? Yes, yes, you can. How? With that. So it is the equalizer, if you will. It is going to take those cases that aren't predictable and making them more predictable. It's going to be your patient's best friend who's not wearing the aligners 22 hours a day. It's going to allow you to do more complicated cases. It's going to allow you to get your cases done in one set of aligners. It's going to allow you to have better retention at the end of the day with the same device the patient's already purchased, and it becomes your best friend. There are knockoffs, but there is no equivalent to the V Pro. You're using the best aligner company in the world, the #1 aligner company in the world, 9 million cases and growing every single minute. Okay, why would you give your patients anything less but the best high frequency device out there? Don't get scared off. That is the business decision that dentists always get scared of. Oh, let me go use a cheaper aligner company. I swear to you, I had a brochure left on my desk today from one of Invisalign's competitors. I won't say their name, Clear Correct. Anyway, I saw the difference in prices. Really? A couple $100? That's the best that you can do? That's why you're trying to sell yourself as a better aligner company? No, you're using old technology. You don't have Smart Force. You don't have the attachment features. You don't have 9 million cases of best practices behind you. You don't have the technology. You're trying to sell yourself as a competitor. It's a whole different league. So if you're using the best aligner company in the world, and I hope you are, it's well worth it. Charge your patients the extra couple $100 if you're not, and decide what you want to do here. You want to charge your patients for a V Pro in a difficult case? Go ahead. They're going to accept treatment. You want to give it, throw it in on an easy case just to make the case more predictable? Absolutely. So I'm going to leave you tonight with what I call the Mars method. And this is something that you do to make your cases more predictable. #1, I am doing 7-day aligner changes for everything. But here's what I do different, which most of you aren't doing. For me, all of my patients are on Monday night aligner change. Monday night. What happens if they start on a Tuesday or Wednesday? You said you change every 7 days, because that first aligner doesn't get changed till at least 7 days plus the first aligner. I want to get them on a Monday schedule. Why are Mondays so important? Because weekends are the bad days for patients when it comes to compliance. They're going to start going to weddings again. They're going to start going to dinner again. They're going to start partying again. All right. And the weekend is day 6 and 7 of the aligner wear. I want them to be good Monday through Friday for sure. Most people are not getting in trouble Monday through Friday. So it doesn't matter if they start. If you start a case on a Thursday or Friday, that means every aligner, every time they go into a new aligner on a Friday, they're going to follow it by the weekend of non-compliance. That's the recipe for refinement. That's the recipe for failure. So you need to be able to have a Monday change date for all of your patients. So if the patient starts on Tuesday, their first aligner gets worn for 13 days. If they start on a Friday, their first aligner gets worn for 10 days. But everything after that, 7 days. So I have everybody on Monday night change. And you want to be an all-star? You're not my competition. You're my neighbors and my fellow dentists. I don't care if I teach you all of my tricks. Have your staff call your patients that first Monday when they're supposed to change and check in and make sure how they're doing. Don't wait till their 3rd, 4th, 5th, 6th aligner to find out that they're not wearing them like they're supposed to. Have your staff on top of it. Now, add the V-Pro. That's your recipe for success. That is your recipe for success. That is your equalizer. You are going to have your percentage of cases that are finished on the first set of aligners skyrocket by adding the V-Pro to your formula. This aligner change thing is only going to help. So that's the added bonus for you. So a little story from a friend of mine, and that wraps it up.
An elderly woman goes to the dentist, and the dentist says she needs Invisalign. She says, but what if I die tomorrow? Suddenly she hears this booming voice, and this voice says, you're going to live another 20 years. She's okay, great, I'll get the Invisalign. After the treatment is over, she walks out the door, gets hit by a car, goes up to heaven. God, she says, you told me I was going to live another 20 years. He says, I'll tell you the truth. I didn't recognize you.
Okay, would you believe me if I told you that I started Invisalign on this lady? So 83 years old. So we're talking a lot about numbers tonight. And, you know, we went from a 63-year-old boyfriend to a 21-year-old boyfriend. I don't say it's from V-Pro alone and Invisalign alone, but it didn't hurt is all I got to say, because her smile matches the rest of her. And I say that in the nicest, most respectful way. Nobody's too old to do Invisalign in my book. So we're going to open it up for a couple minutes of Q&A here. I'm going to ask you to type into the Q&A section. Unfortunately, I cannot hear you guys. I'd love to hear and see you guys. So we are going to see if you have any questions available. So if you have any, type them in. I know I did an amazing job. There may not be any questions here tonight, but let's take a look for a couple of minutes. Somebody say hello at least, so I know you're out there. Okay, so the question was, do you use mostly V-Pro or MOPS or both? Okay, so V-Pro, MOPS, or both. So I use mainly V-Pro. I do MOPS if I have a very difficult to, say I have a lateral incisor that's rotated 60 degrees, okay, and we really need to have something working in my favor. I've also used both at the same time. So when you have a really difficult case, you can use both, but I tend to lean towards doing V-Pro, but I do not hesitate to do MOPS. I'm a fan of doing them both. So no problem with that. I need to get a little better view of my questions. Okay, sorry. MOPs are supposed to last 4 months. Do you often repeat MOPs? I generally don't repeat MOPs because once you get the bone stimulated and the teeth are moving, you're kind of on track. So usually MOPs, it's one time I do it. I have had some cases I've done it twice, but no more than that. Is the V-Pro an option with an Invisalign case when you submit a new case? Let me read that. Is the Invisalign an option with an Invisalign case when you submit a new case? So just to clarify, you will order your V-Pro from Propel, not from Invisalign. So if you have an interest, you've signed on to this with Propel or Invisalign here tonight, but you do not get V-Pro from Invisalign, you get it from Propel, two separate companies. They're both sponsors of tonight's webinar. So I'm sorry if that's confusing anybody, but you get the V-Pro from Propel. Is there, I don't know if that's a real question or not. Is the, I'm going to read this question, but it's your question, not mine. Is this vibrator with batteries? No, this vibrator is not with batteries, okay? And I should be more mature when I'm answering that question, but you caught me by surprise with that question. You charge it. You can charge it with a USB, so it does not come with batteries. How often do you tell patients to change the aligners if you're doing MOP? I generally stay on 7-day aligner change for almost everything. Very rarely do I deviate from the 7 days. Sometimes I will go 5-day if there's a reason, if it's a simple movement, but if I'm doing MOPs, I'm usually at 7-day aligner change. How are you? I'm good. Do you change aligners in 5 or 7 days? It doesn't matter if it's an adult, teen, or child. Congrats, it's a great lecture. Big hug, Leda. Okay, from Brazil. Okay, so thank you, that was very nice. So does it matter adults or kids? Absolutely. A compliant, why do you think orthodontists love to work on kids? It's young, soft, low density bone, teeth are more predictable, moving them in kids. So the older the patient, the more difficult the movement. So if you have a super compliant kid and say they have graduation coming up or they're going away to college or something like that's happening, and you know they're super motivated, I'll do a V-Pro in that patient on 5-day aligner change, no problem at all. You know, adults, depending on the movement, it all depends on the movement, 5 days or 7 days. But thank you very much. That was very nice. Any experience with MOP and patients taking bisphosphonates? That's a good question. I'm gonna stay out of trouble with this and say no. Okay, I don't have experience with bisphosphonates and MOPs, but if you check with Propel, I can assure you they have the studies on it. So I would be careful on that. I do not have any experience with it, and I don't want to give you the wrong answer. But if you check with the Propel rep, they will tell you. I don't have a problem with that. Some nice emojis, being grateful and happy. I appreciate it. And how are we doing on time? Okay, we are right at 8 o'clock. So I'm going to thank you all tonight because we were scheduled for 1 hour and I turn into a pumpkin soon. But this is fun and I enjoy this, and I'd enjoy it more if we were live. What I want to share you with tonight is to wrap this up is, look, I am a humongous advocate fan of tooth alignment and clear aligners and Invisalign. I believe it from the bottom of my heart. I know the difference it makes in patients' personalities, in their confidence. It sounds like a joke, 63-year-old boyfriend, a 21-year-old boyfriend. I can't promise that's going to happen on everybody. All right, but that's just, I share that with you to let you know the confidence it made in this young lady. And I will tell you, we see it time and time again, and that's what clear aligners do. And if we can make these cases more predictable, we all want to be more profitable at the end of the day, unless you are independently wealthy. And I say to you, if you are, then please come work for me for free. But you should increase your profitability whenever possible and use all the tools available to make it as profitable as possible. So very important for you to order your Invisalign. There's a question here right at the end. You order your Invisalign separately and then you order Propels. We have them in the office and we just deliver them to the patients is how we do it. That's how our workflow is. Start your case, we charge it up in the office, we hand it to the patient right there. So with that, everybody be safe. Hope you all get vaccinated if you haven't already real soon. And please, when I see you live in lecture, remind me that you saw me at this Propel lecture, because you got to see me, but I didn't get to see you. So everybody have a good night and be safe. Thank you all very much. Have a great night.